Hello everyone, welcome to H Dental PG. Myself, Dr. Shweta Acharya, here to discuss the daily discussion questions that we had for the past week, which were basically on epidemiology. Also would like to request all of you to register for the online test series that we are conducting for the aim to crack the NEET 2019. A study was conducted between the annual sales of asthma drug and death due to asthma. This is an example of the correct answer is ecological studies. Ecological studies are done to look at the association between exposures and outcome in the population rather than individuals. The biggest drawback of such studies is that their inability to link exposures to outcome in individuals. This phenomenon is also called as the ecological fallacy. Another drawback is to control the confounders. Coming to the next question, nested case control study is a type of. The correct answer is prospective study, as nested case control studies is a type of cohort study, also referred to as prospective studies, in which all those who develop the outcome of interest become the cases, while those who are free become the control. The advantage of such studies is that there is omission of confounders and the problem of recall bias is completely omitted. Last but not the least, it is cost effective. Coming to the third question, in a study done to establish smoking as the risk factor for a disease, 30 out of 50 smokers developed the disease, while 10 out of 50 smokers developed the disease. The odds ratio is, the correct answer is 6. Looking at the 2 by 2 table of this, we have A is equal to 30, B is equal to 20, C is equal to 10 and D is equal to 40. Odds ratio is calculated in the case control studies and is a measure of risk. It is nothing but a cross product ratio, that is AD divided by BC. The correct answer on calculation is 6. Coming to the next question, it has been said that people consuming large amount of vegetables have lesser chance of cancer because of beta carotene. However, this may be due to increased intake of some other factor in the diet, example dietary fiber. This can be explained by, the correct answer is confounding. A confounding factor or a variable is one that influences both the dependent and independent variable, causing a spurious association. Here, the independent variable is the vegetable, the dependent variable is cancer, and the confounder is dietary fiber, which has an effect both on vegetable intake and cancer. Coming to the last question, desks provided with tabletop to prevent neck problems is an example of. The correct answer is primary prevention. Looking for more details, look at this table. A primordial prevention is nothing but when there is no risk factors, that is, there is complete prevention is done with no emergence of risk factors. This is very difficult to achieve, the example being no availability of tobacco in the entire world. Then coming to the next is primary prevention, where there is appearance of risk factors but no disease. The mode of intervention is health education and specific protection. Moving over to the secondary prevention, where there is appearance of disease, that is, it is in the early pathogenesis phase. The mode of intervention is early diagnosis and prompt treatment. In the tertiary prevention, that is the late pathogenesis phase, the mode of intervention is disability prevention and rehabilitation. Thank you everyone for your patient listening. Stay tuned to the YouTube channel of H Dental PG, and also all those people who are interested to crack the MDS 2019 exam, register for the online test series coming.